Hello and welcome to 18 WJTS in.form. We are very honored to have somebody take time with us this morning, and that is Shawn Werner. He's the Administrative Director of the Dubois County Health Department to talk about COVID and vaccinations going on. Hello, Shawn. How are you?
Good morning. Thanks for having me.
Well, let me start off by saying that we really, as a public, owe a debt of gratitude to the Dubois County Health Department and all the health departments around the state of Indiana and throughout the nation who are really doing yeoman's work to get people vaccinated, to get people aware of COVID. I know that you work late and you start early, and just let me say thank you very much for what you and your crew are doing.
We appreciate that. That means a lot.
Now, vaccinations have started. And man, just like that, you were booked up, sold out, so to speak, although I know these are free. So what's now the next step? You're doing vaccinations now. Let me ask you first, how is that going?
The first days under our belt, we had a little hiccups with the software and kind of worked through those kinks. But overall, it went very well. I think, dealing with the 80-year-old population is a blessing. They're super sweet and very appreciative. So we were very thankful the first day went very well.
Are you concerned about people who are maybe that age going, I'm too old to worry about it, I'm not going to get the vaccine?
That's definitely a concern. Another concern of ours is getting the population here to us. I know we've had some calls for some homebound, and it's very difficult for them to get to us. So there is a service that 211 will provide. If you absolutely need transportation, you can call that number and they will try to help assist that.
Okay, but they will have to come to you to get the shot.
As of right now, the shots are available by appointment at the Dubois County Health Department. That's correct. You can have a family member bring you any way you can get here. If you absolutely can't get out of the car, you would just have to let us know that when you get here, and we'll do whatever we can to accommodate you. We don't want people just to wait in their car just because they want us to come to us. We absolutely need you to not be able to get out of your car, because it will slow our process down greatly if we have to send a nurse and a registrar outside.
This is really such a monumental task. It's not so much getting the vaccines to you. It's more just the time it takes to do a vaccine. Somebody to walk in the door, you get the paperwork, you got to give them the shot. You know what? That's got to be an administrative nightmare to be able to organize all that.
We're used to that, but this is a whole different animal. Now we have to, on top of just giving the shot and doing all the paperwork, we have to social distance, we have to wear our mask, we have to do all those things. Then we have to monitor the individual either 15 or 30 minutes after the immunization. So we were used to flu shots and other things where you can get the population through very quickly, but now, we have the monitoring afterwards. So it's caused a whole different problem as far as holding those individuals, having the space to do it. So we're trying to work our way through those kinks as well.
Okay, simple question. Is it basically a shot in the arm?
Yeah, it's in the deltoid, so the upper arm.
Okay. Now, someone did ask me, what are the side effects? And I'm thinking that's probably just like any other kind of a shot.
Yeah, I think much like if you've ever had a shingles shot, I know the elderly population is familiar with that. So, arm soreness, you might have headaches. I've heard of fatigue. Those types of symptoms. So, and that'll all be explained to you, whenever you get the shot, the symptoms and the contraindications, all those types of things. You'll get that paperwork whenever you come here to get the shot.
Okay. Now, obviously, healthcare workers and EMTs, people like that, have been vaccinated or been given that opportunity to get vaccinated. Now you're starting to vaccinate the general public, which is 80 years and older, and then the next tier. Can you explain kind of how those tiers will go?
Yeah, so the State Department of Health controls all the eligibility. We don't have any control over that, and we're strictly following that guidance. So healthcare workers were first, then long-term care residents and staff. Now they've opened it up to first responders, those types of fire, and then also the 80-year-old population and above. The state, I believe the next group will be 70 and above, but we have to wait on their guidance for that to happen, and we'll put press releases out, and I'm sure the state will let everyone know as well. I believe they're sending postcards to 80-year-olds just so they are aware and how to sign up as well.
Now, I'm imagining that what happens here in Dubois County is much the same in Spencer County and Perry County and Martin County. Is it all kind of basically the same?
It will be. Clinic hours may differ. You know, we may, if we can get more vaccine, we may put on like mass vaccination clinics where we try to do, say, 500 or so in a day rather than just 30 in a day. And that's all depends on how much vaccine we can get. Right now, we would be doing more, but we don't have the vaccine to do it for the first 2 weeks. They just gave us a limited supply, and that's all that we can do for the first 2 weeks. Unfortunately, we would like to get it out faster, but just can't do that right now.
I'm glad you brought that up because people need to understand you're not controlling this. You're just making do with the best of what you're being given.
Yes.
How do you come up with enough people to be able to actually administer the vaccine? I mean,
so right now we're using our health department staff, which is, you know, an undertaking in and of itself. We've been struggling just to get everything done. Now on top of this, you know, we've kind of had to shift some gears and just make it work. But when we start going to bigger clinics, we're absolutely going to need help from the community, retired nurses that want to volunteer, even clerical staff. And we've kind of been working on compiling that list of workers as well and trying to get that in place for when we do go to mass vaccination clinics and need all those extra workers.
Okay, now as time goes along, if you get the vaccine, if I get the vaccine today, I'm not immune tomorrow. There's a long period of time. I don't want people to think, oh, I got my vaccine, I'm going out and doing what I normally do.
Yeah, it basically, you get your first shot, you have to wait. For the vaccine, we have Moderna here at the health department. So that is a 28-day wait. So you get your first one, 28 days, we'll schedule your second appointment. You'll come back, get the second immunization or shot. And then I believe it's a couple weeks after that before the CDC is saying that you have immunity.
Now, this 28-day waiting period, does it have to be 28 days? What if it's 31? What if it's 32?
There's a 4-day kind of grace period there. So 28 to 32 is what we really want to schedule you in. But we're trying to get you back on the 28th day as much as possible, because what we have to realize here is we give 300 shots, you know, say these first 2 weeks. The next, once 28 days comes, now it's going to be 600, and we've got all those people coming back. We're trying to get them so we know exactly when they're coming back on the 28 days, so we can account for that. But it's kind of something that you really have to plan day to day and make sure you have enough vaccine to get the second shots done.
Yeah, and what you ask too is that people just understand, because like you mentioned, you may do 300 vaccines, but then it's going to double, and that becomes exponential as time goes on, as the numbers get bigger. Mm-hmm. We can all do our part in some way. The public can help you in many ways, and you've been preaching it over and over and over, and we've been mentioning it on the air over and over and over. But you know, human nature is human nature. But what are the things that people can do that can help slow the spread of COVID?
Yeah, so I think everybody is probably familiar with it, but just to reiterate it, you know, obviously when you go outside in public places, you need to wear a mask. It's not our mandate. It's the State Department of Health executive order that we're trying to enforce. So, you know, just be mindful of that. We wear the mask to protect people around us. If you would have the illness, you know, the mask helps you from spreading it. And there's 30 to 40% of the people that have it and don't even know it and could be spreading the virus. So, you know, that's one of the biggest things. Social distance when you get into these public places. Try to keep, 6 feet apart. You know, wash your hands often. Good personal hygiene. Don't touch your eyes, your face, your nose, your mouth, those types of things. And if it's all possible, try to stay home as much as possible to avoid close contact. And one of the biggest things I think people get comfortable when they're around their family members. So when they have gatherings such as Thanksgiving and Christmas, you can almost look at the charts and see the numbers of how they spiked after those types of events. Because as well as I do, you get into your mom or dad's house and you feel comfortable there. You take your mask off and you don't really social distance, and that's where we're seeing a lot of the spread.
It's probably important too that you stay within your own town, so to speak, within your own circle, and not go outside that.
Yeah, and travel is definitely frowned upon by the CDC, and we kind of put all that guidance out for Christmas and Thanksgiving, those types of events where people travel more. If you absolutely have to, then we strongly suggest that you wear your mask full time. Try try to stay away as much as possible if you're on an airplane or a bus or anything like that. And then, obviously keep your hands and out of your face, nose, mouth, and wash them often. Hand sanitizer works as well.
How important is if you're not feeling well, not to go to work or not to go to a function?
It's absolutely vital. I mean, people, they think, well, I just got a headache today, or I got a sore throat or a runny nose. This is just allergies, or this is just normal for me. And right now, not a whole lot of illness is going around other than COVID. Yeah, there's the flu, there's the common cold, but a lot of what we're seeing right now is COVID, and you have to be extremely mindful because this is a very contagious virus, and it spreads very quickly if you get it around other individuals.
Okay. What is something else you'd like to add? I mean, we're giving you a microphone to talk to public and to tell them, let's slow this spread down. Some people go, well, I don't get it that bad. It's not that bad a disease. It's not that bad. Well, maybe not for you, but for others it is. We have several people who are passing away now. It seems like every day. What would you like to tell people?
Yeah, absolutely. I mean, for 90% of the population, they will get over this illness. And we're grateful for that. We're glad it's not a higher death toll, because we would be, unfortunately burying a lot more people. But, for those elderly, that about 60 to 70 to 90-year-olds or 80-year-olds, the state's kind of calculated about 93% of that population is where the death's coming from. Those are the vulnerable population that we're trying to protect. So, we obviously ask, to do everything you can, try to slow the spread until we can get this vaccine out into the community, and also ask for the community's patience, because, our doors are getting beat down and the phones are ringing off the hook for people wanting this, and we're thankful for that. But right now we're limited by the amount of vaccine that, we have and we can give. So as soon as we get it, we will definitely, open it up to the public. And once the state opens up to eligibility, we'll try to get it as fast as possible.
Yeah, you guys do a really good job of keeping us informed, and then we turn around and keep people informed. So,
yeah,
if you're wondering when the next time is you can register, just keep listening. We'll let you know.
Yeah. Hopefully, after the 25th, our schedule will open back up and we can accommodate more people. So I know it's very confusing to try to have to go to a website and register. This is not really normal for us either, because normally a flu shot, you just walk in and you don't need an appointment. But this is a whole different animal, because we have to register on this website. We have to collect all this information from them, and then try to manage that schedule on a daily basis. It's got glitches where certain people might be scheduled 2 times in one 10 minutes. So we have more people scheduled than we have vaccine for. So then we have to try to accommodate for that. So it's definitely a learning curve.
Okay, I'm glad you brought the website. Folks need to know that I don't know how to use the internet. I'm not sure how to register. That scares me. Fine, talk to your grandkids or talk to your kids and have them get you registered.
Yeah, the absolute best way is to find somebody that can operate the internet. Go to that website, and we urge the people that are signed up to completely register. That speeds up our process so much more, and to try to make sure all the information is as accurate as absolutely possible. Because if you get here and it's not filled out and you don't have your insurance information in there, then we have to take the time to get all that information from the individual while they're sitting there. And then, then after that, we can give the vaccination. It won't let us give the vaccination until all this information is entered in there correctly. So if anybody is, registering, please complete the registration until it says you are registered. It'll say unregistered or registered. It needs to say registered.
And one more thing is there is no charge for this vaccine. So folks don't need to worry about that.
Yeah, anybody that comes through the door will get the vaccine for free as long as you're a legal U.S. resident. And the only reason they want insurance information is because the state is providing a administration fee to try to help health departments and hospitals across the United States to keep this process going.
Okay, well, and now you make me ask another question, and hopefully this is the last one. Is there an ID that people need to bring? If they are registered, they need to come in with something?
They need to bring their driver's license, their insurance cards, if any type of insurance. So if they're on Medicare, they need to bring their supplement, all those information. It needs to be entered into the system, but those also need to be brought along just to verify whenever they get here. And then if you sign up, you have to be one of those eligibility groups, and it's on the website. If we have a 60-year-old sign up and they're not eligible, unfortunately, we'll have to either turn them away at the door, or if we see that on our schedule, we'll call them just to make sure they are eligible, because it's not fair to all the other population out there that want it. And if we let one of those slip through because we just didn't do our part to screen those out, that's, we don't want that to happen here. It's easier to follow the guidance and stay to that. So we just ask those people to be as patient as possible. And as soon as we can open it up to them, we will.
All right, Shawn, thank you so much for taking the time. I don't want to hold you from putting a vaccine in somebody's arm. Really, are you doing some of that work? Are you?
I don't give the shots, but I help with the registration and direction and all that stuff, and keeping my staff ready to go.
All right, Shawn, thank you very much. Shawn Werner has been our guest. He's the Administrative Director of the Dubois County Health Department. Thank you for being our guest, and thank you, folks, for watching 18 WJTS Inform. We are local people watching local people.